it's not just about sex, because your sexual function is the warning sign for your general health.
Mm.
Meaning, when you have good sexual health, you have good heart, you have good blood flow to your brain. The carrot is, hey, if you have good health, you're gonna have good sex life, and they parallel each other.
I'm Rachel, and you're listening to the Owning Your Sexual Self podcast. Welcome, everyone. Thank you so much for continuing to listen. I, as you know, I am someone that works with sex and relationships primarily. I work with both individuals and couples. I got asked that this morning from my chiropractor. He's like, who do you see? Like, who do you help? Who are usually the clients that are sitting in your chair? And so I gave a little background, and I just love having these conversations with people that I see on the regular that, don't know what I do. And it was a nice, refreshing conversation this morning. And then I was reminded, ooh, I have a podcast today, and I get to talk about men's sexual health this morning. And as someone that works with both individuals, that would be any gender, as well as couples, again, any gender, any relationship type, uh, I am excited because for so long have more so worked primarily with women, coming with my background for peer romance. For the longest time, only women were allowed at peer romance parties. And so primarily my expertise is in women's sexual health. And so it's very refreshing to have guests like today. Today I have on Dr. Anne Truong coming on the show, and she specializes in specifically men's sexual health. And so it's just, again, refreshing to have somebody else that is an expert in that genre, if you will, in that field, and to be able to ask the questions. And I love that now episodes like these get to be a resource for the men that listen to the show, or for those that are the other partner in the couple who are partnered with a man that want to get their partner more involved with this work. This is an episode that they can be able to send to their partner to be able to listen. And that gets you one step closer to being able to do the work together, which I think is just wonderful, right? And let me say, on the other hand of that, that doesn't mean if your partner is not into doing the work, I'll use my air quotes, that does not mean that you cannot continue to do your work. I believe that when we are the best versions of ourselves, that only helps us bring out the best version of our relationship, or sometimes see that maybe the relationship that we're in is no longer serving us. And that's okay too. So let me tell you a little bit about Dr. Anne, before she jumps in the show today. Dr. Anne Truong is a board certified physician, a global speaker, and best-selling author specializing in men's health and regenerative medicine. With over 20 years of experience in the medical field, Dr. Truong has helped thousands of men reclaim their vitality and confidence through innovation, holistic solutions that prioritize long-term wellness over the temporary fixes. As the host of the podcast Sexual Health for Men, Dr. Truong empowers her audience with actionable advice, cutting-edge research, and real-world strategies that improve sexual health naturally. Her unique approach integrates lifestyle adjustments, advanced technologies like stem cell therapy, and a focus on overall health to address the root causes like for issues like erectile dysfunction and declining sexual performance. I'm excited. I'm definitely excited to hear more about this cutting edge therapy, root cell therapy that she's talking about, or I'm sorry, stem cell therapy that she's going to be talking about on the show today. And so again, okay, let me stop chatting. Clearly, I'm excited to be able to go into this. Dr. Truong has just an extensive background, as you heard, over decades and decades of being in this work, and I'm really excited. Yeah, we're having this open conversation, as you know I like to do, genuine conversation, curious conversations on the show, no shame, no judgment, helping you all own your sexual self. All right, let's get the show on the road. All right, welcome, Dr. Truong. Thank you so much for coming on to the show today.
Oh, I'm glad to be here.
Yes, when I was saying it's just so refreshing when I get those emails that come through for people that are primarily working in men's sexual health. And as we were talking a little bit offline, we know that this also affects the partners that are partnered with the men that we're working with. So, yeah, I'm excited to dive into it. Thank you so much again.
Oh, I'm excited to share information about sexual health because there's so much misinformation out there, and it's a taboo topic. And we wanted to really bring it. One of my mission as a medical doctor is to bring it out of the shame, and demystify and bring it into mainstream, kind of like how we brought depression, anxiety into mainstream now. And sexual health is health, and that it is expected to have sexual dysfunction when you get older. It's like almost like getting gray hair. But I make an analogy for you. Like if I give a talk and I ask how many people in here have high blood pressure, and you don't think twice about raising your hand up, right? But if I ask how many in here have sexual dysfunction or ED or female sexual dysfunction, maybe one person out of 100 will raise their hand up because we feel that shame that, that like I'm not good, or this taboo topic where it should be like raising on the level as like depression, anxiety. It is part of living, it is part of aging, but you don't have to live with it. You don't have to be you don't have to live with it irreversible. It's not irreversible. It's kind of like obesity. You gain weight, it's not irreversible. You have to work on it, of course, but the message is that expected, and there are things you can do about it. So learn about it and be educated so that way you know how to prevent it.
Yeah. Yeah, I like that. Like stepping more into the acceptance for something like ED, for example, right? Like almost expecting that somewhere along your lifeline that there might be some issues with your penis getting hard or staying
Hmm.
hard, right? And so
Hmm.
if we can, yeah, move away from the avoidance of like, oh, I hope this doesn't happen to me or this isn't going to happen to me, step into the acceptance of like, all right, I'm ready for when it does, and be able to arm ourselves with those resources and knowledge to be able to manage and have conversations, right, with doctors, partners, things like that. My gosh, yeah, like how it would just look so much different for when, if and when that does happen to someone.
Right, because it's once you feel that you can bring it up and it's part of you feel that's part of your health, you can discuss it with the doctor. And also, I have to admit, doctors need to be aware of treating sexual dysfunction as well, because we weren't educated on that in our training. And most of what I've learned about sexual health is I had to seek it on my own after I've been a doctor practicing for a while. There is no one specialty, uh, doctor specialty that is totally dedicated on sexual health. So it could belong to primary care, it could belong to pain management like myself, it could belong to urology and OBGYN. It really should belong to every doctor specialty, because it's like pain. Everyone has pain, and you're going to encounter pain as you get older, and you're going to encounter sexual dysfunction as you get older as well too.
Yeah.
So I want your listener to understand that it's okay, it's expected.
Yeah.
And if it is expected, know what you need to do, because there are other options besides just taking ED medication, or even now penile implant.
Hmm. Yeah, that's I've talked about this on my show before, like how quick a lot of doctors are to just prescribing the pill. And what I find, so I work, I'm a therapist, and so when I work with people that are experiencing symptoms of ED, I'm really finding that right when they've gone through all the physical tests and blood flow is good and heart rate is good and circulation is good and all these things, urology tests are good, testosterone is good. It's like, well, what the hell, And so I'm finding a lot of times it is more mental based. There's some maybe trauma that happened or some sort of rupture in the relationship that happened, or performance anxiety that's going on, just pressure that we place on the penis. So it's very interesting. And what I'm finding, and you could probably speak a little bit more to this, but clients that are coming to me, male clients that are coming to me with ED, It seems like it's the age is getting younger and younger. I've had men in their 20s, 30s, and generally, I remember growing up thinking like this was a old people, like an old man
Mm.
problem, and that just is not seeming like the case. So I know one of the things that you're well versed in is just this understanding the decline in men's sexual health. Can you tell us and speak more about that?
Well, I'm glad you raised that up. We're seeing more and more incidences of erectile dysfunction in younger men. And I will tell you this, if you're younger men, when we say younger men, it's probably maybe less than 40,
Mhm.
because the incidence of physical causes of ED is more common in men over 40. And so usually let's kind of like fast track and say what are the risk factors of ED? Right? If you have high blood pressure, if you're overweight, overweight meaning your BMI more than 28, and if you smoke, if you drink excess alcohol, like more than 14 drinks a week, and also if you are not getting adequate sleep. Those are the things that are put you at risk. And so also diabetic, but diabetic kind of comes with obesity as well, right? So those are like the risk factor that put you at risk, and usually you acquire those conditions when you are older, right? So when you're older, you don't exercise as much, you have more stress, you have family and other things. But when you're younger, those factors do not as common, but we're seeing younger men now that are vaping. Vaping is probably even more harmful than smoking, because we don't know what those vapors are doing inside the lungs. Over time, we will be. And then with the age of social media and computers, they're not exercising as much. A lot of computer, games, video games like this, and also porn, easy accessibility of porn. When I was growing up in the 80s, the only way you could get porn is through a magazine,
Yeah.
and you get it and as a VHS cassette, but you have to be over 18 to even access that, right? So it now is so easy, you can get it on your phone even. So there's that porn factor, there's vaping, video games, and also not eating well. You're eating fast food, food that are French fries and just energy drinks. Those energy drinks that are full of sugar and chemicals. So those are kind of like the risk factors for younger men. So when you do those activities, it decreases your testosterone, and especially porn, it messes up your perception of sexual arousal in your brain. And so because of those risk factors, we're seeing more of incidences of erectile dysfunction and low testosterone in men. And then there's also the aspect of psychological ED. Younger men experience more psychological ED than older men. And I'm not saying that there's anything wrong with that. It's just that if let's say they drink a lot that night, and they had sex that night, and it didn't happen, right? And that incident, it didn't happen. But then he's thinking the next time that he's with the girl, it may happen again. And the more you think about, am I going to able to get an erection, the more that actually becomes the opposite, that you won't. So the more you overthink it, the more the prophecy come into reality. So we're seeing a lot more psychological ED, and maybe that's related to marijuana. I haven't even touched upon marijuana as well. Maybe the availability of marijuana even in the vaping component of that, and the legalization of marijuana. And so, but marijuana do, put you at risk for anxiety
Mm.
and mood disorders as well too. So that's what we're kind of seeing, it to be what related to lifestyle factors, but those are all things that you can stop or control with your lifestyle.
Mhm.
It's not like you're over 50 and you have prostate cancer, or you're over 50 and you have a heart a heart attack that put you at risk for ED. These are like if these guys know that, hey, if I'm watching porn, it messes with my brain about real sex. Maybe they should stop, But you don't know what you don't know. I love that phrase. You don't know what you don't know, and you keep doing things until somebody tell you, oh, if you do that, that's not going to be good for your sex life. Then you go, oh, now, it's like it makes sense. So I'm hoping that your listener hear this to know that, hey, these things can really harm your sex life. But the thing about it's not just about sex because your sexual function is the warning sign for your general health.
Mhm.
Meaning, when you have good sexual health, you have good heart, you have good blood flow to your brain. And so the I guess the carrot is, hey, if you have good health, you're gonna have good sex life, and they parallel each other. You have a sexual dysfunction. You're also gonna have a blood vessel problem that may affect your heart as well as put you at risk for other cardiovascular disease as well.
Mhm. Yeah, not to mention, right, like things like avoiding prostate cancer or just prostate care in general, for women, avoiding things like vaginismus, atrophy, prolapse, right? Like yeah, staying sexually active. God, I love that you're a doctor and you mentioned this because I'm not a doctor and I say this all the time, like how important our sexual health is and our sexual function is. Because you're exactly right. And yeah, I've never really thought about it in that way of like, take that look of your what's going on in your sex life and how is that attributing to the rest of your overall health, you know?
Right, right. I make the analogy: take care of your sexual health, and or your health. Remember, sexual health equal good general health. Take care of it like you take care of your teeth. What
Mm-hmm.
do you do with your teeth? You brush your teeth, you floss, you brush it twice a day, you mouthwash. Why don't you do that to your sexual health? You know? Why don't you do that as well? And how do you do that? Like I mentioned before, smoking, alcohol, sleep, de-stress, like, more meditation, and watch what you eat and exercise. Those are the main things,
Mm-hmm.
that really curtail a lot of heart disease and diabetes and high blood pressure and high cholesterol. Nowadays, you know, 67% of Americans are overweight. And when I see a patient, it's normal to see them on a blood pressure medicine, a cholesterol medicine, a diabetic medication.
Mm-hmm.
And it's okay, but it's not okay. No, it's not okay. You shouldn't be on the triple medication and say that, oh, I'm okay. You're not okay. You need to work on your risk factors, because when you're on those medications, there's always long-term side effects. And one of that side effects is affecting your sex life.
Mm-hmm. Mm-hmm. Yeah. Yeah, and I like that you also mentioned this was a bit ago, but how you mentioned that for medical physicians, there is not a sex doctor, right? I'm having sexual issues, I'm going to go to the sex doctor. Like I'm having teeth issues, I go to the dentist. And that's very interesting. And I think of just the rapid growth of things like sexologists, clinical sexologists, things like that, sexology, sexological body work. Like there's all these different little thing, right? Sex therapy, for instance, right? Like I was a regular therapist first and then became a sex therapist. So that's interesting, yeah, that they haven't developed that yet. But you mentioned that you sought this out. I'm curious what direction did you go to learn more about this self for yourself as a physician?
It's all by motivation. Because I tell you, I'm a medical doctor, so I've been trained in allopathic method. Allopathic method is more reactive medicine. And then in 2000, I started learning about acupuncture because I'm a physical medicine and rehabilitation specialist by trade, which means I do non-operative pain management. Everything that for pain management without the surgery. But in 2000, I was seeking a more of a long-term method to help my patient with pain, and I learned about acupuncture. When I learned about acupuncture, it opened up my eye to a whole new different dimension of healing the whole body, and how the whole body, every organ is interconnected with one another, and there are different type of healing system other than what we learn in medical school. So that lead me on the path of more natural treatment and functional medicine. So I started doing prolotherapy, and then I started doing more stem cell therapy in 2005. And in 2012, I started moving into more sexual health because a family member of mine had sexual dysfunction and couldn't tolerate taking ED medication because of the side effects. One of the main side effects is headache, blue vision, and also back pain. So I wanted to help him get over that, and he knew that I was doing stem cells. So that started my deep dive into sexual health and reaching out. And I have to attend conferences that are all over the world on learning about sexual health. I had to learn from sex therapists. I had to really create my own curriculum to learn about sexual health. I talk with urologists, OBGYN, the sex therapist, and just kind of pave my education, and then doing a lot of reading and reading articles and based upon that, and that's how I kind of came up with my Get Hard system, with the six system to for sexual health involving the mind and body and relationship to restore sexual health again. So and we can talk more about that. I call it the Get Hard system, but it's really more the sexual health system. But I wanted to kind of make a point that, hey, this work. So that's how I unfortunately I had to seek my own specialized education because there's really no certification. There's no curriculum. There's no school that you go to get this all in one place. And I've been talking with several doctors right now that we're working on that type of training where doctors can come and get a comprehensive approach to sexual health other than, hey, Viagra, Cialis, and trimix injection and penile implant. There's a lot more going on. And then part of it is learning from non-traditional medical practitioners like naturopathic doctor, to people like yourself and other ally health that is treating sexual health as well, because we know that sexual health is not just the penis not working or the vagina not working well. It involves biopsychosocial, the biology, the psychology, the social, it's one of the most complex system to treat because it involves relationship, it involves your psychology, and it also involves your biology as well too. So that's why it really takes a multidiscipline approach, but that's hard to do in one area. It's for that's why a lot of doctors are not trained on this when they get out of their training and residency. And that if they are interested in treating sexual health, they have to find the education themselves. And most doctors are so busy, they don't have the time for that. I mean, we are required to take 50 to have 50 CMEs or credits a year to even maintain our own specialty, and then having to have full clinical practice on top of that. So sexual health is really right now a much needed field. I think it's as much as even heart health, but